All right, it's 4:30, so I will call the March 1st, 2021 Health Committee meeting to order. All members are in attendance, so we have a quorum. We have minutes to approve from February 1st regular meeting. Is there, which was our January meeting. What?
I apologize, that is a typo on my part. I thought I caught that. So it's February 1, 2021 regular meeting.
Right.
Yeah.
So thank you. I'm just reading this and I'm like, wait a minute, that doesn't make any sense. Can I have a motion to approve the minutes, please? Motion by Chun, second by Johnston. Any additions or corrections? If none, Ms. Morlock, would you please call the roll?
Member Martin.
Yes.
Member Metzger.
Yes.
Member Chung.
Yes.
Member Johnston.
Yes.
Member Beer.
Yes.
Member Bloomfield. She looks like she froze. Member Bloomfield, can you hear me? Did everybody freeze?
No.
Or is it just, okay.
She left earlier and came back in. She may be having some technical problems.
Okay. Chairman Schaefer.
Yes. Minutes are approved. Do we have any members of public?
We do not, Chairman Schaefer.
Okay, thank you. So then
I apologize. This is Lindsay Bloomfield. I'm present. My internet was frozen. Thank you.
okay. Moving on to departmental matters. First up is Suzanne Scott from Adult Detention Medical. And Suzanne is on.
Yes, I'm here and I don't have anything in particular to report.
Are there any questions for Ms. Scott? Okay, there are none. Thank you very much.
You're welcome.
Next up is Jason Tabb from Juvenile Detention.
Good afternoon. I don't have any items for action. You have my general report. I'd be happy to answer any questions if you have any.
Are there any questions for Mr. Tabb? Hearing none. Thank you very much.
Member Metzger had a question.
I have a.
Oh, I'm sorry. I missed that one. Sorry.
It's okay. Mr. Tabb, the last time you were talking about nurse replacement, I believe, were you successful with that or is that still outstanding?
We have a couple interviews set up for this week, so we hope to find the right person this week.
Perfect. Thank you.
Thank
That's
you.
all.
Okay. Anyone else? If not, thank you.
Thank you.
Next up is Jessica McKnight, Health Department Administrator.
Hello, everybody. So you have my report. I don't have any items for action this evening. You have my report, but I wanted to take a few minutes just to go over some FAQs that we've had for COVID-19 vaccine. One of those being, when will we move on to phase 1B plus, which is the phase 1B expansion that the governor announced earlier in February. So there's roughly 50 to 55,000 people in phase 1A and 1B. And as of today, we're about 35,000 doses into that 1A and 1B. So, looking ahead, we're about 43% through that 1A and 1B. So about 43% of that 1A, 1B population has received at least their first dose of vaccine. Would be ready to move ahead to expand eligibility criteria as soon as early April. That's, if we start getting more vaccine, we could go sooner. But as of right now, if we're receiving about 2,500 first doses a week as a county, then, we're still looking at early April for that 1B plus expansion. Other questions I'm getting is about the Sangamon County Fairground vaccine site, asking about, is that open to other counties? And, how is that possible? That site at the state fairgrounds is it's a statewide site in partnership with the National Guard. So it is open to any Illinoisan. Also being asked, what is the process for the local health departments requesting vaccine, and why are we not requesting more vaccine? So, we definitely, it's not that we don't have vaccine, not because we're not asking for it. We, every week we're informed how much vaccine we'll receive. And I say informed because we're just told, here is your allocation. There's no asking, can I have this much? Right now, that allocation that we're told about is for the current week and a projection for the next 2 weeks, just a projection. And when I say we order vaccine, at this point, that just means that I look at that number that we're told we will get and figure out how that will be allocated amongst the health department and the other partners in the county that we're distributing to. So about 8 other partners that are also receiving that limited supply of vaccine. We have submitted what we'll call additional orders. So, if we're allocated 800, I have submitted additional orders to IDPH, kind of a wish list of, I know you say we're only going to get 800, but we can take more. So we have additional orders for vaccine in excess of what we've been allocated. Only one time have we received any additional vaccine. We've also spoken with IDPH and our local elected officials about the need for more vaccine. So we're definitely doing all we can to advocate for more vaccine for McLean County. Also asking, how are we addressing vaccine inequity? We're working with community partners and planning targeted clinics. We've worked with Carl Broman to have a clinic for age 65 and over. We've also worked with Bloomington, Normal, NAACP, Western Avenue Community Center to have a clinic last week at Mount Pisgah for our Black and Brown communities. And we're working on additional 65 and over clinics this month. So I just also wanted to take a second just to, I know things are looking better in terms of our new cases reported. So last week we had about 150 reported through the whole week. And, we were reporting over 700 in a week earlier this year, just, in about a month ago. So things are definitely looking good, but, we're not out of the woods yet. So the South African and UK variant have both been detected in Illinois through sequencing. So right now we can't let up on our efforts. It's actually time for us to double down on this. Until we can get more vaccine, get more individuals vaccinated, it's very important for all of us to continue wearing our face coverings and social distancing now, especially again with those variants that are more infectious. So at this time, are there other questions?
Member Martin.
Hey, Jessica, I heard today that one of the hospitals up north in the Rockford area was asked by the state, I assume, if they could handle any Ebola patients coming into O'Hare. You heard anything about this?
Have not, no.
Okay. More to come, I guess.
Mm-hmm.
Member Johnston.
Thank you. Ms. McKnight, I'm assuming that the 2-week projections are newer, that we haven't been getting those for very long. If you've had enough to like a week or two of how close are the projections to what we're actually getting? I know this is very early in it, but just trying to get a sense of how accurate they're being.
Yeah, just for a couple of weeks, we've been getting those. And luckily for us, they have been on the low side. So, what they have projected for us, we've gotten a couple hundred, like 200 or 300 more than we were projected, which is awesome and fantastic. And then I can fulfill, add more clinics and more spaces to our clinics and fulfill full orders from the partners that are requesting.
Okay. And I know that you said that we have detected the variants in Illinois. Have we detected them in central Illinois?
I believe the UK variant was detected in McLean County.
Okay. Okay. It's good to know. Thank you.
Anyone else? Member Chung.
Thank you. And thank you, Ms. Mcknight, for all the work you've been doing and all of this update and everything. I know that we had, when was that storm? Was it 2 weeks ago? It's like, what is time anymore these days? I know that there had been the cancellation of the clinics that happened. Is everybody all caught up there? And was everybody able to get their doses, the ones for the clinics that had been canceled or had been postponed?
So last Thursday, we had the rescheduled from the original, I think it was the 16th, the Tuesday. So that clinic happened last Thursday. And then we've got a clinic tomorrow that is the reschedule from the 19th. So we, reached out to everybody who was scheduled. Some had already gotten it elsewhere, which is good, but everybody is going to be within that 42-day CDC recommendation as well for their appointment.
Anyone else? Member Beer.
Thank you. I know that was it yesterday or this weekend that the Johnson & Johnson vaccine got passed finally and approved. Do you know when we can expect that would hit us? And like how that is going to play into, since all the other ones are 2 doses and this is a 1 dose? And like, do you have any idea of what that looks like, or is it too soon still?
It's still pretty early. IDPH are starting to talk about it. We don't have any specific recommendations yet from ACIP on the populations that should be targeted with that. But IDPH is saying that we should expect to start getting it. It will be less at the beginning, just because it hasn't been manufactured like the others have been for a while. So I don't know when we can expect to receive our first doses of that, but it's approved now, so hopefully soon. And I expect that, I think tomorrow maybe ACIP is meeting to give clear guidelines and recommendations on who they would target with that vaccine, because it is only the 1 dose. So there are going to be populations that it's going to be more useful for, individuals that you may not be able to reach again for the 2nd dose.
Anyone else? Member Chung.
Thank you. I remember that, was it last time, but was it last week when you had the what is it? I guess the meeting that was for vaccine hesitancy that they had, was that last week? I didn't have a chance to watch it. I was just wondering if you have any sort of feedback from it. How was it received?
Yeah, feedback has been fantastic. And I believe we're working to get it up to the county's YouTube page. I think we also shared it on our Facebook. So it's recorded so that anyone can go back and watch it. But yeah, really, really good feedback. And I guess one feedback is the call center. We have heard, just hear anecdotes that one individual had called and said they had watched that and it completely changed their view on the vaccine, and now they want to get the vaccine where before they did not.
Okay, anybody else? I want to comment about what Ms. Mcknight said about working with IDPH and our representative. Remember at the full board meeting that I had mentioned, I had reached out to Senator Berkman and Representative Brady about helping us get more vaccine from McLean County, and talked about the Senate hearing where there were a lot of there were several other counties that were saying it was not being distributed equitably, or they didn't feel that way throughout the state. And Representative Brady finally followed up with me and got, for the last 2 Fridays, we've actually had phone calls with the Chief of Staff of IDPH. And it was myself, Carla Pohl, Ms. Mcknight, Chairman McIntyre, Colleen Kennedy from Carl, and Lynn Fulton from OSF, or a combination of those. Not everybody was on all the calls, and trying to get some answers to some of our questions and concerns about some of the disparities between counties and how much vaccine has been received and things like that. And sometimes we got the standard non-answer answers and and some of the times we just didn't get an answer. And so we're still pursuing, trying to get more vaccine in McLean County. Through that route, they have heard very clearly our concerns, because we weren't shy about some of our thoughts on things. And we're like I said, continuing to work with that. What Ms. Mcknight had said about asking for more, doses and not getting them, yet seeing other counties getting many doses more when it's supposedly based on population. And you can clearly see that there's other factors somehow in there. So we are continuing to work through our representatives to get more vaccine, and hopefully we will get more vaccine sooner rather than later. So I just want to let you all know that we continue to work on addressing that issue to get more vaccines. So that's what I have to say about that. Any other questions for Ms. Mcknight? If not, Ms. Johnston.
Thank you, Chairman Schaefer. Just very quickly, I appreciate the work that you guys put into the Mount Pisgah vaccination. Is that something that you guys are going to repeat, or is that going to be repeated with regularity, that we can kind of make sure that we're promoting out there in the community?
Yeah, we're looking at doing several targeted clinics. We've got our rural communities, as well as there are areas in Bloomington Normal that we want to get to. So if we're definitely looking at that as a repeat in other locations as well.
Okay, thank you.
The one thing I had heard about that too is that the number that they had gone through at Mount Pisgah, they also then reached out to Western Avenue to see if there were people that could come to that. I don't know what how that all worked out, so that there is a lot of interest and working together with that population. And as Ms. Mcknight said, we've had several rural areas that have requested clinics too. So just need more vaccine. So thank you. Anybody else?
Ms. Schaefer.
Oh, okay. Member Metzger. Yeah, well, you're real small on my screen, so that's why I can't see when you do that.
Two things. I wanted to thank you and thank Ms. Mcknight for acknowledging the need to go to our rural communities. I'm sure Member Martin would agree that we have a need of people that are unable to really travel into Bloomington Normal. So thank you very much. And also I wanted to tell you, I saw you on the, I watched the Chamber of Commerce presentation. I think it was last Wednesday, and wanted to thank you for doing that.
Okay, anyone else? If not, thank you. Or do you have anything else? Yeah, you're gone. Next up is Ms. Edens from the Nursing Home Administrator.
Hello. Can you hear me? Okay. I have one thing up for action, and basically that is a hospice contract with Hospice Compassus is the name. It was actually brought to us by a resident who we admitted who had this hospice company at home and wanted to continue to use this hospice company because they were familiar with it. So basically that's what this is basically just for her, but they're going to send me a hospice contract for the whole building to present maybe next month. But this one's just for her, so we'll see how that goes and kind of go from there. And other than that, I didn't have anything else on up for action, and you have my report if you have any questions.
Okay, so first we have request approval of a nursing home facility hospice service agreement, single patient with Community Hospices of America, LLC, doing business as Hospice Compassus, Northwest Illinois. Is there a motion? Motion by Johnston, second by Martin. Any questions? Since she just answered the question, probably that anybody might have on that. Any other questions about it? If not, Ms. Morlock, please call the roll.
Member Martin,
Yes.
Member Metzger,
Yes.
Member Chung,
Yes.
Member Johnston,
Yes.
Member Beer,
Yes.
Member Bloomfield,
Yes.
Chairman Schaefer.
Yes. And then you have your monthly report. Does anybody have any questions regarding her monthly report, or did you want to, is there anything you'd like to point out on it?
We are 100% COVID free.
Awesome.
Isn't that awesome? Yeah,
yeah,
for five,
I think
5 weeks. Yeah, so we are off of the IDPH watch. So that's always a good thing. And just very proud of my staff for the hygiene that they're doing to the residents and themselves and keeping up with it. Even though it's dwindling down in the community, which certainly helps, and the vaccination, those are complete, so that certainly helps as well. So,
Any questions? Member Chung.
Thank you. And Ms. Edens, thank you again so much. I was really happy to read that in your report that, we don't have any cases at the nursing home anymore. So that's a real relief, I think, for you and for your staff. So thank you again for sort of, I guess, seeing through all these really few difficult months. And on your report, you say all vaccines completed. Is that with all the residents, or is that residents and staff? I guess I was just wondering if I could get a clarification on that.
well, they've had the 2 sets of vaccines completed, and then they had them come back to do the first vaccine on the ones that didn't get it the first time. But all of the residents, 98% of the residents have all taken the vaccine, both vaccines, and I would probably say 50 to 60% of the staff thus far. And I think I'm going to try to encourage them to watch Ms. McKnight's thing, because I think that would certainly change some of their minds. So yeah, so we're trying to get a little bit more information out to them so that they understand the importance and how it's going to benefit them as well as us. And everybody, they're still doing good as far as wearing masks and things. They just need to go a little bit further and get that vaccine.
Yes, thank you for that. And I guess, I think definitely showing that and leading them towards that discussion that they had, and any other sort of resources to really try and see what we can do to convince them to get it would be great. I just had a thought about something else. Oh no, I can't remember now. But oh yes, I was going to ask about new, and then you had said that you were going to require vaccines for new residents that come in, and that's still the case then?
Mm-hmm. They are getting them before they come in, and if they don't, Walgreens, we can always take them to our Walgreens, and they will do them too. So,
Okay,
because we have a contract with them, yeah.
Thank you so much.
Mm-hmm.
Member Johnston.
Thank you, Ms. Edens. I noticed that we had started taking admissions again. I think we had 3 in this report. That's a good thing. I've seen our census dwindling down. But one of the things that I was curious about is our current staffing and how much we're needing to access contract staffing given our current census.
We are still using contract staffing. Unfortunately, it's, we're not getting a lot of applications. I think I've said this in the past. I don't know if it's people don't want to change jobs right now, because of the pandemic. It's a little scary. And then, we're just not getting applications. So yes, we are still using agency staffing more than I'd like to, but
How
they
many
have been a godsend right now.
how many open positions are we looking for?
We are looking for at least 6 to 8 CNAs and about 4 nurses.
Okay. That's quite a bit to fill, but we'll just keep putting it out there, and thank you for everything that you're doing.
Thanks.
Okay, anybody else have any other questions? Okay, thank you very much.
Thank you.
All right, moving on is, next up is Ms. Rodriguez, County Administrator.
Thank you, Chairman Schaefer. County administration does not have any items for action this evening, and our report on recent employment activities is on page 38 of your packet. If you have any questions, I'd be happy to answer.
Are there any questions for the administrator? Okay, hearing none.
Thank you.
Our next meeting is April 5th, which is our regular meeting. Does anybody have any other business or communication? Okay, if not, I have bills to pay, and the auditor has reviewed them all, and they comply with all of our ordinances, resolutions, and policies. And so first is the Board of Health has a prepaid total of $322,707.23. Motion by Chung, second by Bloomfield. Ms. Morlock?
Member Martin,
Yes.
Member Metzger,
Yes.
Member Chung,
Yes.
Member Johnston,
Yes.
Member Beer,
Yes.
Member Bloomfield.
Yes. Yes.
Okay, thank you. Chairman Schaefer.
Yes. Next up is Developmental Disabilities Board has a prepaid total of $93,504.46. Motion by Johnston, second by Junk. I want to keep looking at Lindsay. Is she frozen on your guys' screen too?
Yes.
Okay. Ms. Morlock, please call the roll.
Member Martin,
Yes.
Member Metzger,
Yes.
Member Chung,
Yes.
Member Johnston,
Yes.
Member Beer,
Yes.
Member Bloomfield,
Yes.
Chairman Schaefer.
Yes. That passes. And so next is jail, and JDC Medical has a prepaid total of $28,704.10. Motion by Martin, second by Johnston. Ms. Morlock?
Member Martin,
Yes.
Member Metzger,
Yes.
Member Chung,
Yes.
Member Johnston,
Yes.
Member Beer,
Yes.
Member Bloomfield,
Yes.
Chairman Schaefer.
Yes, and that passes. And last, we have the nursing home has a prepaid total of $369,924.86. Motion by Bloomfield, second by Chung. Ms. Morlock?
Member Martin,
Yes.
Member Metzger,
Yes.
Member Chung,
Yes.
Member Johnston,
Yes.
Member Beer, Member Bloomfield,
Yes.
Chairman Schaefer.
Yes, and that passes. So we've paid the bills. Does anybody else have anything before I adjourn? If not, this meeting is adjourned. Thank you.